I'm Dan Collins with Mercy Medical Center in Baltimore, Maryland, and you're watching Medoscopy. Thanks for joining us for today's procedure. Today's guests are Doctors Max Shlykov and Justin Park of the Maryland Spine Center at Mercy. Dr. Shlykov, I see you're fluent in Russian. Is that where you're from originally, or where are you from?
So I was actually born in Uzbekistan, and then I moved to Russia when I was 4, and then I came to the States when I was 9. My mom brought me here looking for better opportunities, and so we settled in San Diego, where I went to college and graduate school, and then I went to Michigan for medical school, St. Louis for residency and fellowship, and then I'm coming over here to the East Coast for work.
So when you were, before you came to the United States, in Russia and so forth, how long were you there?
In Russia, I was there for 5 years, and then in Uzbekistan for 4. So I was able to, I came over early enough where I was able to maintain my fluency in Russian, but also pick up English and not have an accent.
I was going to say, was there any kind of cultural readjustment that was necessary, or do you remember?
Yeah, I was pretty young, and so I was kind of thrown into it. I didn't know English at the time. I was in 4th grade, so it was definitely kind of a little bit of a shock from just being, not being able to speak English, but quickly all the kids in school kind of got me up to speed, and yeah.
Now, speaking of languages, Dr. Park, in addition to English, you're fluent in Korean and conversational in German. Now, what's your connection to those languages?
So I'm a second-generation Korean American. I was actually born in the United States in Michigan, and then my family ended up settling in Indiana. And so growing up in a Korean household with first-generation Korean American parents, I always had to keep up with the language, so to speak. I also, even though my vast majority of my relatives were in South Korea, kept up a very strong relationship with them. And either every year I have relatives coming to see us, or I can remember at least 3 or 4 times in my childhood growing up, going back to South Korea for summer vacation and things like that. So it was always important within our family to maintain the ability to speak the language in order to maintain that connection with our family. And so it's actually worked out very well for me here in my adult life and in my professional life, as I do take care of a good number of Korean patients. And I think that's been very comforting for a lot of them to see a provider that speaks their native language and looks familiar to them. So that's kind of my connection, obviously, to speaking Korean. In terms of German, it's very similar to you, Dan. I think I had heard in one of your interviews that you'd studied a lot of high school German. I did the same and started learning German in high school. And then when I went to college in Indiana University, taking those entrance exams as a liberal arts major, you have these foreign language requirements. And I actually tested out of a lot of years of German. And so decided that I would pursue additional Germanic studies classes in college, and through that chain of events ended up studying abroad in Germany for 6 months my junior year, and then also spending a separate summer in Austria. And so
Österreich.
That's right. Yeah, Österreich. And ended up picking up a major in Germanic studies. And so there was one point where I was very comfortable speaking the language. Now it's more of listening to people speak German and then participating on a smaller level. But I have very fond memories of my time in school, not only studying German, but also spending time in those countries and living with host families and really immersing myself in the culture. So
you mentioned you had some work in the liberal arts. And doctor, what was your major when you were in college?
It was in human biology.
Okay, so human biology, I can see a easier connection to medicine from human biology. Liberal arts, when did you decide that, I'm going to go into medicine?
I think I knew that I was going to go into medicine as a high schooler. So I was actually a biology and chemistry major as well.
So what made that interesting? In other words, why did you think that I want to go into medicine? That's going to be a path to a happy life for me.
Yeah, for me, I think when I was thinking about kind of what I liked and going into college, I did think just from high school that I enjoyed biology and the sciences, and so that's what I chose to major in. And I think biology just gives you the introduction to the human body and physiology. And so once I started college, I began shadowing doctors and going to the operating room, and that was kind of one of my first experiences with patient care. That really kind of, I think, pushed me towards medicine, and yeah.
I think I share a similar kind of pathway. I know that going through school, I was never a really strong writer. I remember whenever I had English classes and writing assignments, I was like, this is going to be a struggle. But then when I was in science classes, those were always very natural to me. I think myself going into medicine, a lot of that, I had relatives in South Korea that were, many of them were physicians. And I think seeing that example when I was in elementary school, and then, to be honest, there's a lot of immigrants who, I think there's an internal family push for their children to become doctors. It's like the American dream in some ways. And so I think a combination of all those things and what I excelled at in school, and then as I kind of navigated my way through college and medical school, I realized that I really do have a desire to be in a service industry, taking care of people. And I think medicine is probably one of those utmost professions where that's where our life is held in the service of people and taking care of people. And so it's extremely gratifying, and I know I chose the right pathway. So.
Now, you're both in orthopedic surgeons, specializing spine surgeries. Was that what you thought you were going to get into when you became a doctor? Or it was like, I was going to be a dermatologist, and somehow I wound up in orthopedics. How'd you wind up there?
I think it's really important to keep an open mind when it comes to, all things. And when I was in college, one of the first experiences that I've had in the operating room was actually in the spine operating room. And I just thought it was so cool and interesting. And so, once I got into medical school, between my first and second year, I did a clinical fellowship in orthopedics, where I acted like an intern almost, just going, right in the morning, rounding, doing cases, going to clinic. And I just loved the people, loved the surgeries, loved the fact that we could help people and really get them back to being active and functional. And I thought that was very, very rewarding. So.
Yeah, I also kind of went into medical school with an open mind. Certainly didn't see myself becoming an orthopedic surgeon from the age of 5. Never tore my ACL and as a teenager. But my first year in medical school, I did have a mentor, a community orthopedic surgeon who kind of introduced me to the field of orthopedics. And I remember it was that first summer, and I was at home for like a month-long period, and he had invited me to come shadow him in the operating room. And he was a general orthopedic surgeon, so his bread and butter surgeries were hip replacement, knee replacement, arthroscopy surgery. And I remember my first day in the operating room with him when he did a hip replacement, and taking a saw and cutting through the femoral neck and taking out this diseased femoral head and doing a hip replacement. I just thought it was the coolest surgery. And shadowing him on a few calls of the ER where he was setting a 6-year-old's both bone forearm fracture, I just I gravitated towards that field. And then going through the process of residency, I distinctly remember my second year residency doing my spine fellowship, or doing my spine rotation within residency, and then feeling as though it was like a whole new field within orthopedics. And just the intricacy of working around nerve roots, I think decompressing spinal cords, it was just very, very exciting and very, very rewarding and challenging. And so from that moment, I kind of knew that I was going towards that path of becoming an orthopedic spine surgeon.
Now, what do you each see as the key to success when a patient walks through your door? I mean, is it understanding each patient's individual goals? I was looking at one patient review, and the patient noted, I wanted to be able to play with my kids again, have the opportunity to throw a football with my son or hold my daughter when she needed me. So when a patient walks in, what's the process?
Yeah, I mean, I think anytime a patient comes into the room, you have to get to know them. I think they want to feel like they're being heard and listened to. I think putting your hands on the patient, examining them, and really trying to figure out why they're coming into clinic. And I think that question of what do you want to get back to doing? What's your goal? What are your treatment goals? Not everybody wants surgery. And so it's really having an extensive discussion, and I think that's a great question to ask. And I think it's just treating every patient like your family member, and giving them the same advice that you'd give them, and treating them with respect. And I think starting from the first visit to surgery to the care after the surgery, it's a whole journey, it's a process, and you have to get them through that difficult time in their life. So I think you have to build a very close relationship and be partners with the patient.
Would you agree, Dr. Park?
Absolutely. I think as you practice, and the longer you practice, you pick up the nuances of what patients are seeking. And so there's definitely patients who are coming to you with a long-standing problem, let's say spinal stenosis. And it's really impacted now their ability to walk, their ability to stand, their ability to just do activities, enjoy vacations, because they just can't walk. And you pick up on pretty quickly with those patients that they're at the end of the road, and they're looking to have a surgical solution. Whereas on the flip side, you'll see people who really, they're coming into you for 2 or 3 days of back pain. And in talking to them, this is not a chronic problem, but it's something that scared them enough that they said, I need to go see a back specialist or a neck specialist. And so for those folks, it's more of a visit where you're educating them and letting them know, hey, you don't need surgery. This is going to get better, and we just need to give this more time. We've got to try treatments like medications and physical therapy, and there's no reason why a month or 2 from now, after doing all these things, you're not going to get back to playing with your kids and going back to the gym and things like that. And so it's figuring that out within that 15 to 30 minute visit. What the goals of the patient are, and what they need to have their questions answered.
We'll take a break and be back with the next segment of Medoscopy.
I'm Dr. Justin Park. I'm an orthopedic spine surgeon, and I specialize in spine surgery. The most common patients I see are those who have spinal stenosis, spondylolisthesis, pinched nerves. A lot of these patients have a hard time walking, standing long distances because of back pain or leg pain. A lot of patients are coming in vulnerable, scared. As a patient, you're not sure why you're having pain. And so I try to be a compassionate, empathetic person that not only is treating the patient, but also giving them the education about what the diagnosis is. I'll talk to them about what the expectations are, what the day of events will be, how long that surgery will take, and then expected recovery time. I think Mercy is a hospital that has a philosophy of taking care of patients, taking care of families, and we as a whole make that effort to really make it a patient-driven, patient satisfaction type of experience.